All right, here we are. We are in the pros department. I've got Dr. Lawrence Wallace here, and an interesting thing for us, we've been thinking about doing some complete dentures. Logistically, that's been a difficult conversation, but they've got an interesting way of doing it here in Florida, in Fort Myers, and a way that they do it around the country. Dr. Lawrence was telling me in California, I believe they did 150? 154 in Phoenix, Arizona at their event, and I just watched a denture get delivered to a patient, and she was super happy, and it looked good. I think it could be a good solution. So I'm going to let Dr. Lawrence tell us about Larell Dentures.
All right, here we go. Go ahead.
Hi, I'm Dr. Lawrence Wallace, the inventor and founder of the Larell One-Step Denture. We have a method where we can make dentures in a single 1-hour visit without the need of an outside laboratory. Because we can do it in a single visit, it makes it an ideal service for people at a mom clinic such as this one here in Fort Myers. It's often difficult, multiple visits, to create dentures, and with this technique that we can do in an hour, we can provide the entire service from extraction of teeth, placement of dentures, and the patient will be finished in about an hour and a half time here at the clinic. We do this all over the country, and we do it for many different states: California, North Carolina, Arizona, now here in Florida, and we hope to expand into Georgia and many other states where the need is great. We just did one in North Carolina where we did virtually the whole town of Gastonia who needed dentures. So the process is done by a thermoplastic template that has the teeth already set. So we've basically taken care of 3 of the initial 5 steps of making a denture. We then take it, prepare it, bring it to the mouth, and customize it right in the mouth so that the patient only has to do this at one visit, one time. The dentist maintains total control over the procedure, and the results are sometimes spectacular and always great.
Very good. Would you like to show us where a few people are in the process right now? I think we're making some initial impressions over this way.
Sure. Come on over here.
All right.
The first step in the process is to take an impression with alginate, a model of the mouth. This is a model of the jaw with no teeth. Once that's done, it's poured up in stone, and we take it back to the laboratory where we choose the proper size denture that will be fit custom for this patient.
Okay.
So
as you tell us, let's walk back to the lab and we'll check it out.
We'll walk back to the laboratory where the remainder of the off-site process is done.
Okay. So Carolyn and Paul, hello. It's kind of, as I was saying this morning, kind of like watching an episode of Mr. Rogers here. Going to see how it's done. So we're walking back. This is where the removal lab is for these guys. We do have, we're making some interim RPDs or flippers in this room, but also this is where we're set up for the Larell Dentures.
So the next step in the process after we have the model is to find the denture template that is the closest fit to the patient. So after we have the model, we find the set that is the closest fit to the model. We measured over 3,000 models to come up with the 5 different sizes that we have. These templates are thermoplastic acrylic with individually set teeth, individually set denture teeth. So the idea is to find the closest fitting template. Once it's trimmed, it's placed into the boiling water for about 45 seconds.
Okay.
And that makes it soft around the sides. We're then able to closely mold it to the model.
Very good.
Now we're ready to take it to the mouth for a custom reline.
So you basically get the fit. You
get the fit in the lab. Approximate here.
And then you
custom fit with the reline in the patient's mouth.
Okay.
So that same template was adjusted on the model, taken to the mouth, and in this case we used the sample model and created the custom reline to create the final denture.
Very good.
It's adjusted on the inside, it's adjusted on the outside for comfort. It's set for the patient's bite and works very well that way. We're also able to use these dentures when you are able and want to place dental implants.
Okay.
So you can take the denture template and place 2 implants into the jaw,
Okay.
and then immediately take the denture template and through the same process embed the attachments into the denture.
So this one was made. This is a Larell denture.
This is a Larell denture that was made for this model with implants.
Okay.
So after about 20 minutes starting, we're able to have a denture that snaps in and is rock solid.
Very good. So this is a process that dentists incorporate in their private practices, and you feel like it's a good fit for this type of event as well?
It's a perfect fit for this event. It's actually the only process that can be done at this event because the patients are only here one time for one visit. Dentures typically take 4 to 5 visits. So that's why they have not been done at mom clinics.
Very
but
good.
A lot of dental practitioners in their private offices all over the country do these dentures because of the convenience of one visit and the cost savings for the patient. And it's very profitable for the dentist. We also do a lot of philanthropic work all over the world. We're taught in many different dental schools, and we have had outreach programs go to Nepal, Nicaragua, Kenya, Peru, Jamaica, Haiti, and many other countries.
Awesome. Well, very good. Well, I will look forward to hearing more about it, and I appreciate you telling us about it. Thank you very much.
Thank you very much.
All right. Bye-bye.